Hi guys, this is Bhavna. We're back again with our next video. For those who didn't watch our first video, my name is Bhavna and I am a doctor currently working in the NHS. A few years ago, I was in the same boat as you, bewildered at my first hurdle to join medicine in the UK, my English exam. They say pain and suffering are the best teachers, and so today, in order to ease your pain, we've set up Teach Your Academy, where a group of doctors and nurses working in the NHS, along with some brilliant English tutors, have collaborated to ease the OET journey of people eager to help us out in the NHS. This is the second video of our series, so if you haven't watched our first video, I would recommend stopping at this point, watching the first video and then coming back to this one just to have a little bit of clarity as to what actually is being discussed right now and why it's important. The OET exam, especially the writing section in particular, is extremely frustrating. Lack of clarity of what's being tested, inaccurate information being taught, and henceforth multiple attempts with the same score are some of the culprits that I can point to. We're going to go through the 6 criteria in detail on this video. Let's go to the official OET site. As you can see on the screen, you can see the 6 criteria being tested in each letter on the writing section of the OET exam. Purpose, content, conciseness and clarity, genre and style, organization and layout, and language. These are the 6 broad criteria by which each and every OET letter is graded according to. Purpose. On the website it says the purpose means that it helps the reader to get a quick and precise sense of what is being asked of them. Let's try to discuss it in detail. I would recommend to everyone giving the exam or even practicing for the exam to start your letter by looking at the last few lines or the topic or the question which is given to us in the writing section or in the letter. While you're reading this topic, ask yourself, what is your role? If you're giving the exam as a doctor, ask yourself, are you a ward doctor? Are you a GP? Are you a locum? What exactly is your role? In what is your role, also ask yourself, what role have you played in this patient's care? Are you this patient's regular doctor? Are you a A&E doctor who's seen this patient for one visit or referred them on? Are you a specialist that's seen this patient just for a particular problem? Or are you a ward doctor that this patient was admitted under? Similarly for nurses, ask yourself, are you a ward nurse? Are you an A&E nurse? Are you a community health nurse? Are you a district nurse? Are you a specialist nurse? How did you contribute to this patient's health care? Did you take care of them on the ward? Did you take care of them in the community? Were you helping out the GP? Were you a specialist nurse for this patient? Similarly, for other specialties giving this exam, if you're a physiotherapist, are you their regular physiotherapist? Are you just seeing this patient for a particular visit? Ask yourself this role. Who is your audience? Who am I writing this letter to? Am I writing this letter to this patient's regular doctor? Is this a letter of discharge? Am I discharging my patient back to their regular caretaker? Am I transferring this patient to another specialist? Am I a GP who's transferring a patient to a diabetes specialist? Am I a nurse who is working in a ward transferring a patient to a community health nurse, or transferring this patient to a nursing home, or vice versa? What is the current situation? Is this one hospital visit I'm talking about? Is this a history of visits I'm talking about? What am I doing right now? Am I, again, reiterating the point, look at the type of letter you've got. Is this a discharge? Is this a transfer? Is this a referral? What is the urgency of the current situation? Is this an urgent emergency referral? Is this a routine referral? Is this a notification? Know your purpose. Know the main point which is important to be communicated to the reader. Are you communicating that the GP needs to give this patient continued care? Does the GP need to make any more referrals? Does the GP need to follow this patient up? If I'm referring to a nursing home, do they need to make referrals? How are they going to take care of this patient? Do you have any suggestions for the care of this patient? You must know the main point you are communicating to your reader. This will become more important when we go on to the second section. Content. You must consider necessary information, and this information is supposed to be accurate. Let's see this in detail and how we can solve this. Read the main body of letter. As continued from the previous section, what is the main thing that we're communicating to the reader? Let's give us an example. For example, if I'm a nurse and I'm writing a letter to refer a patient to the dietitian for management of their diabetes by dietary measures. The main thing that I want to communicate is that this patient needs help with their dietary care. Supporting information would be any information about the previous diet you can see, any issues with compliance, is this patient able to cook at home, does this patient have carers, does this patient have any social history which might be important like alcohol. Another example, if you're trying to refer a patient to, for example, a diabetes doctor, your supporting information will be your history of diabetes, their medications, any issues with those medications, any issues with compliance. Their dietary history would become important as well. You might give them any information about their admissions with diabetes complications. The third question would be the background information useful to the reader. For example, if I'm writing a letter to a psychiatrist or a psychologist regarding the referral for a patient with a psychological problem or a psychiatric problem, social history is one background information which becomes important. Does this patient live alone? Do they have any friends? Do they have any social support? Occupational history becomes important. Are they unemployed? Are they on benefits? Are they in financial difficulty which might be increasing their stress? Sleep habits, eating habits, drinking habits, alcohol habits, drug habits, all of these become useful background information for a psychiatrist or a psychologist because this might impact their care. Make sure you include everything that's important or maybe pertinent. For doctors especially, I would give a tip. You guys know medicine, all right? There's no question about it. I believe every one of you is an excellent doctor in your home country. You know in each and every letter what your diagnosis is. For example, is your diagnosis thyroid, hyperthyroidism, hypothyroidism? Is your diagnosis diabetes, insulin dependent, non-insulin dependent? Is your diagnosis obesity? Is your diagnosis alcoholic steatohepatitis? Each and every one of you knows what the disease is. Read the letter, know your disease, select history of presenting complaints and your positive history. If you're able to do that, which I'm sure you will score very well in the content section. This is a section which you can score highly in, but often because of misinformation being given, you're not able to score well. But have confidence in your medical ability. If you're a nurse, I'm sure you're an excellent nurse. You know what psychological impact of social factors and drug and alcohol misuse is. Don't miss out on your background information. You can do it. Now, the opposite of content is conciseness and clarity. It's important that you know what is irrelevant and you effectively communicate your point clearly. For this, ask yourself, have I included every important thing that was covered in content? Have I eliminated the irrelevant things? An easy approach is read your text, read your question, then ask yourself, am I wasting the reader's time? Am I giving them information that they might find useless? Am I adding words to my letter which make it sound boring, useless, and does the reader now feel like I lack in medical knowledge? For example, if you're making a referral to a community health nurse and giving them information about a minor surgery that the patient had 10 years ago, do you think the community nurse is going to think that's important to them? Going back to the diabetes example, if you're telling the diabetes consultant about a fracture that the patient had 20 years ago, will that be actually important to the diabetes consultant? You guys have worked back home. You guys know the little time that we have as doctors. Make sure you don't waste your readers' time. Be concise, be clear, and be to the point. Next criteria, genre and style. I've told you guys about what you're very good in, but there's something that we might lack as doctors back home is register and tone. This might be a word which is new to you. Register and tone basically means the way you sound on paper. Let's see what that means. Try and put yourself into your reader's shoes. For example, think about if you were a GP or you were a consultant or you were a community health nurse who's already quite busy, and she's got a letter from this doctor or this nurse asking them to do something. Does the letter sound formal? Does it sound like it is an official letter? Does it sound rude? Make sure if you are making referrals, if you are transferring care, you use words like I request, please, I would be grateful. It's very, very important to sound gentle and not to sound arrogant. I know because of the language barrier, we often struggle with this, but this is the section that sometimes we lose unfortunate marks in. Another point for this section is using abbreviations that the reader is not familiar with. If you're using, for you guys, DM, diabetes mellitus, very common abbreviation, but that might not be as familiar to a non-medically trained psychologist. It might not be familiar to a dietitian, might not be familiar to a physiotherapist. Don't lose marks over laziness. Do not use abbreviations. As a rule, to make yourself safe, do not use abbreviations in any case. Even if you're writing to a diabetes consultant, write insulin dependent diabetes mellitus. Don't be fancy. Don't try to act over smart. If you don't try to act over smart, if you sound kind, if you sound respectful, you will score in this section. Right. Organization and layout. This is a section I want all of my students to score very highly in. This is a section that you can score full marks on. Know the formatting of a letter. Know where you write date. Know where you write address. Know how you write subject. Know your paragraphs. Know your paragraph spacing. Have a letter which has flow. So you have your introduction, you have your body, you have your conclusion with a reiteration of the purpose. Ask yourself, do my thoughts flow or are they jumbled up? Am I talking about a patient's past medical history and then going to present and then going back to past? Am I talking about a patient's present history, then past history, then going back to past history, then going to family history, then going back to past history? Don't make this mistake. Make sure before you put your pen or your pencil to the paper, you know what you're going to write and where you're going to write it. Alright. I will be discussing the ideal format of a letter in subsequent lectures. Language. This is a section that non-native speakers often struggle with. Make sure you don't make silly mistakes on grammar. When you have your last 5 minutes, revise your letter. Look at where you're supposed to use a, where you're supposed to use the. Look at where you're using capital letters, where you're using small letters. You don't need to have advanced grammar skills for the OET exam. You need to know basic grammar. But in panic, we often mess that up. If you struggle with your writing, make sure your spelling doesn't look wrong. Make sure your E looks like an E and not an O. You don't want the examiner to think that you can't spell basic medical terms. You guys know everything. Don't mess silly things up. Know your connecting words. Know your punctuation. Revise your letter, please. I don't want any of my students to make silly mistakes in language. This is the most frequently failed aspect of the OET writing exam. make sure you aren't part of the majority. I will be making a lecture on basic grammar skills on the OET exam. Alright. Now, going back to the site, you can see the first page just shows the same expanded in terms of level of writing. This is already being discussed, but you guys can go through this again. I would recommend that for people who've already given the OET exam and have scores in front of them, if you've scored a 290 or a 340 or lower than that, just make sure you go through this page and see where you stood and how would you grade your band. Look at the section you scored the least in and work on it. Do not give the OET exam again and again thinking that you'll pass writing by a fluke. You need to have a strategy. Learn from your mistakes. This is also applicable to people who might not have given the exam already. If you're writing your sample letters, go through the writing assessment criteria, go through the questions I've written on my PowerPoint, and then go through the descriptors and the banding score. Grade yourself. Be your own harshest critic. Right. Now, we've gone through all the 6 criteria, so hopefully you should have an understanding of what's going on in the OET exam, why aren't you scoring well, what exactly is the problem, and how you can find a solution. We will go through the grammar topics in subsequent lectures. I will try and go through a sample letter in the next lecture. It would be very helpful if you guys can like, comment and subscribe on this channel, because it encourages us to work more hard for you guys, or harder for you guys. Yeah, but just keep on practicing, don't lose hope, and good luck.